Close your eyes for a second and imagine a little secret door inside you. Small, soft, and a bit mysterious. That's the cervix, not a magic button, not a treasure chest, just part of your body that behaves differently in different people in different moments. Some people say it's ultra sensitive, others barely notice it. Urban legends whisper that it's a forbidden zone that will curse you if touched. Nonsense, but a perfect hook for curiosity. I teach sex science, and I've run workshops where nervous adults tiptoed into exploration like explorers in fog. One night, after a long Q&A, a workshop goer admitted they feared penetration. We didn't jump to hard technique. Instead, we reclaimed agency with 3 simple things: light touch, steady breath, and predictability. And that's where machine masturbation, meaning automated toys or devices, can become an ally. Not as a shortcut to orgasms, but as a tool to make sensations consistent and less scary. Predictable vibration, steady pressure, and a timer can help the brain learn safety again. Start like a gentle scientist. Step 1, observe. Take a warm shower. Use a mirror if you like. And notice your body without judgment. Name sensations: warmth, pressure, nothing. Step 2, breathe into your pelvic floor. Slow in for 4, out for 6. Let muscles soften. Anxiety tightens muscle. Breathing releases them. Step 3, external exploration only at first. Try a small, body-safe device on the outer labia or perineum at low setting. This is about learning what steady, predictable touch feels like. If you feel safe, you can experiment with small, medical-grade dilators, ideally guided by a pelvic floor therapist, to retrain comfort with deeper sensations. Safety rules are sexy in their own way. Use devices made for body. Clean them. Use water-based lubricant. Never force anything and stop at pain. Read manuals and check material. Silicone and stainless steel are common, safe choices. If you feel pain or persistent fear, to see a pelvic health specialist or sex therapist. These professionals know how to break fear into small, manageable steps. Now, for a little spooky amusement, there's a campus legend about a cervix bell. An old student who swore like the timed vibration made them feel like a church bell in the deep. It's silly, but it captures the truth. Rhythm and timing can change how our nervous system interprets touch. A machine can give you that rhythm while you focus on breath and gentle muscle relaxation. That combination turns a scary unknown into a predictable experience. Tonight's tiny experiment: take 10-minute warm bath or shower, soft lighting. Breathe for 2 minutes. Place a small device on the outside, low setting, and count breaths while you feel it. No goals, no pressure, only observation. Keep a notebook. What felt strange? What felt safe? Who did you learn? Curiosity beats fear when it's paced and protected. Treat your body like the stubborn friend it is. Explore slowly. Use tools that give you control. And remember, myths are fun, but your safety and consent are everything.